Hi, I've decided to research Paget's disease for my presentation topic. Paget's disease is a condition that disrupts the way that our bodies recycle old bone tissue with new. Over time, this condition will cause your bones to become fragile and misshapen. It usually affects the pelvis, skull, spine, and lower legs. This condition causes the bones to develop new tissue faster than the normal rate, which makes the bones softer and weaker. The accelerated rate of the bone formation causes the new collagen fibers to be laid down in a disorganized manner, instead of in the traditional linear fashion, which is why we see that the bones become more fragile. This can lead to pain and deformities as well as fractures. It also makes you more susceptible to gain arthritis and hearing loss if it's within your skull. It can also cause some nerve damage if you have it within your spine, and it can compress on different nerves in your back. Biphosphonates are usually prescribed to help with this pain, and it can also help to regulate the bone recycling process so that the bone growth is more like our normal. The cause for this disease is still currently unknown. It could possibly be caused by a virus, but there's not really enough evidence to prove that this is the main cause for it. It could also be hereditary or environmental factors that cause this to happen. The sequestosome 1 gene, the TNFRSFIIA gene that codes for the RINC protein, and the VCP gene have all been linked to this disease. However, they can't say that this is like the reason that you develop this disease because not everyone has a mutation with that gene. These mutations do, however, cause a disruption with the signal that can lead to osteoclast activation. The osteoclasts of a person with Paget's disease have more nuclei than normal. Osteoblasts could also be increased, but because the osteoblasts themselves, like their internal structure, doesn't become compromised, this isn't the true cause for the bone deformities, it's the osteoclasts. It's typically diagnosed, a person with Paget's disease typically gets diagnosed by elevated serum alkaline phosphatase, since most people are asymptomatic, or they happen to think that their symptoms are just increasing with age, because most people don't get diagnosed with this disease unless they're older in age, like 40s and 60s. So most people think that it's just typical osteoarthritis. But looking at your different levels, you can notice the elevated serum alkaline phosphatase, as well as looking at scans, you'll notice the deformities and how the bone is structured. You would be able to see that in different bone scans.